benefits to taking birth control at all,
right?
Besides the obvious of, decreasing your risk of getting pregnant. And are there any conditions, some of which you mentioned before, like PCOS, where it is appropriate to take, or is there a better option? So let's start with
benefits.
Benefits.
Well, one of the benefits actually for women who might decide never to have children is actually the prevention of ovarian cancer, and mostly because it gives the chance the body to pretend it's pregnant like once a month. So that's just one protective benefit from that. Also, for a woman, what sometimes they call like the athlete's triad, which is basically women who, although I feel like, some like either a woman who has an eating disorder or a woman with like the athlete's triad who perhaps maybe during a period of time isn't getting her period, and she's not getting her period because her hormones are too low to get a period. Not getting the period is not necessarily the problem. The big problem is bone health. And so for premenopausal women, we are in like the prime time of bone building. And if you don't have enough estrogen, that's one of the problems why some female athletes do develop osteopenia and even osteoporosis before the age of 30. So in that case, again, like it would be better to, address the eating disorder or address the overtraining, but at the same time for bone preservation, perhaps birth control at that point would be appropriate. On the other side too, like if a woman really has incapacitating periods and is just not really ready, as I mentioned before, to make some of these critical changes, birth control would also be mostly, if it's really impacting this woman's life, I think birth control would be an appropriate option for her. As far as other benefits, there's like some cosmetic benefits of, certain forms definitely help with like clearing of skin, but then there's so many other things that one could do also to clear skin that don't involve any hormones or pharmaceuticals. But everyone is their individual and on their own individual journey. So for some people, perhaps using birth control would be a better option.
Gotcha. I know we didn't talk about acne and birth control, but I know that you do work with a lot of patients that have tremendous success healing all different sorts of acne through naturopathic methods. Correct?
Yes. It's like one of my specialties.
Yeah, I would say so. Okay, so I feel like I covered everything I wanted to cover. But let's just open up to some of the people who are on here. If you have any questions for us right now, live and in person. I know some people did post some comments, so let me open up that and see what they said. I want to see all the comments on Facebook. I can't see all the comments. Let me scroll and see if I can see them here. Let's see. What about women that suffer from extreme PCOS, like me, whose symptoms are so extreme that without birth control went a whole year without getting their cycle? I guess what would be recommended in that case?
Again, I feel like this is, there's so many layers when it comes to PCOS. So first, like definitely looking at the critical labs and maybe even looking at some more specific adrenal labs. There's so much that's involved as far as, again, not just looking at direct hormones, but also there's different types of PCOS. So there's definitely PCOS that's much more kind of like the classic insulin dysregulation issues. So looking both from how to address it through diet, also addressing specifically giving if I wanted to just say one specific nutrient that I find that really works really well with a lot of PCOS patients is inositol, specifically D-chiro and myo-inositol, because it really helps a lot with insulin. So that's just one little factor. So typically if I have a PCOS patient and they're more the insulin blood sugar regulation issue picture. Diet, nutrition specifically for addressing that piece, but then also kind of thinking more downstream. So giving patient key nutrients and herbs that are going to help with basically, there's a lot of little fine nuances, but the way that basically testosterone turns into estrogen and more downstream, and really trying to improve the aromatization of, because one of the big things is having too much testosterone, so regulating that. There's also there's so many different formulas that I like. One, when it comes to the testosterone piece, I really like licorice and peony for my patients. That seems to work really well. So that's just one example. But then I also have some patients that are kind of like this other picture of PCOS where, they're not overweight, but they have all the other classic symptoms. Maybe they have facial hair, acne, their hair is thinning, really irregular periods. They tend to be more the adrenal picture. So really working on tonifying the adrenal system. So, and then there's some women that there's a combination there, and also sometimes you have to even look deeper. If I have a woman with PCOS, I understand that she's one of these types, but still is not having improvement. Other things to rule out would be looking at her digestion, like ruling out things like leaky gut, even thinking about things like SIBO. So there's a lot of definitely PCOS can be very, very complicated.
Yeah. Okay, so it sounds like it's really a case-by-case basis.
Yeah, absolutely.
There's so much involved. It's not a 5-minute or a 1 or 2 minute, 5-minute answer. It's involved. So, but it sounds like you do have success with people who are struggling with PCOS. So that's really great to know, and I think opens up more possibility, especially for some of the women who are watching this, to know that there are other options, which is kind of what this is all about. There was one other question that came through.